Okay, Assalamualaikum, and now I will tell you about three common injury in hamstring. So hamstring is divided into three, that is semi-tendinous, semi-membranous, and bicep femoris. That divided again into two, short and long bicep femoris. Okay, now this is the first common injury in hamstring, that is muscle strain. Muscle strains have divided into three.
For grade 1 muscle strain, it might have tightness on your hamstring. You may be able to walk properly. You won't have much swelling on your hamstring. For the recovery process, it may take 1 to 3 weeks for the grade 1 muscle strain. For grade 2 muscle strain, you probably cannot walk properly. You may get sudden twinges of pain during activity. You may notice swelling on your hamstring. It may cause pain when you press the pain at the injured part. You cannot fully straighten the knee, and you cannot fully bend your knee. It will cause pain to the injured person. For the recovery process, it may take 1 to 2 months if you want the grade 2 heal. For grade 3 muscle strain, you will unable to walk. You will feel severe pain. You will get bad swelling appear immediately after the injury. Any contraction like straighten the knee or bending the knee, you will be so painful. It will take 3 to 6 months to recover from grade 3 muscle strain.
Okay, now there is the second common hamstring injury, that is called sciatic nerve or sciatica.
For the next injury for hamstring, it is called sciatic nerve or known as sciatica. Sciatic nerve is caused by a variety of lower back conditions that may lead to sciatica. It is also commonly a lumbar herniated disc will cause sciatic nerve pain, a mild sensation to extreme pain in the lower back and buttocks and down to the leg. It travels between the hamstring and the buttocks. Sciatic pain is caused by the iliopsoas. The iliopsoas originates from the anterior lumbar vertebra through the pelvis. It is into the top inside from the thigh of the bone, as you can see in the slides, the yellow line. For reducing pain of sciatic nerve, you have to do regular hamstring exercise and stretching. Yoga also will be helpful for reducing the pain. For the serious sciatic nerve, you may have to do some injuries for healing the sciatic nerve.
Okay, so now this is the third common hamstring injury, that is called chronic high proximal tendinopathy.
For the next injury from hamstring, it is called chronic high proximal hamstring tendinopathy. The chronic tendinopathy may be triggered from an acute tear of the tendon that doesn't heal properly. It is because the prolonged inflammation of the tendon, known as tendinitis, it is obvious. It can trigger eventual degeneration of the hamstring. This brings damage to the tendon part. You will feel pain deep in the buttocks, upper thighs, back of the hips, that it will start gradually, little bit by little bit. Repetitive usage of the hamstring, it may cause pain. You will also feel pain when sitting, pain when bending fully at the waist. For example, pick something on the ground. For common spot that will get this chronic high proximal hamstring tendinopathy, such as sprinting, because the repetitive usage and the hamstring muscles did not recover properly.
So hamstring may become fatigued faster than quadricep during high-speed activity. flexibility, muscle overload, and lastly, previous injury. When one muscle group is much stronger than the opposing muscle group, the imbalance can lead to a strain. Frequently happen to hamstring since quadricep muscle at the front, it is usually more powerful. So hamstring may become fatigued faster than quadricep during high-speed activity. Those especially at risk are who play football, basketball, a sprinter, a runner, or an adolescent athlete who are still growing. Occur more often because bone and muscle do not grow at the same rate. Bone may grow faster than muscle. When do sudden jump, the impact can tear the muscle away from the connection to the bone. Fatigue reduces the energy absorbing capabilities of muscle and make them more exposed to injury. Lack of flexibility focus on warm-up. Before start training or do main activity, we must firstly warm up to reduce muscle soreness or any injuries. Our hamstring will become short and tight without stretching. Muscle overload occurs when the muscle is stretched beyond its capacity or challenged with a sudden load. This happens when you extend a muscle while it is weighted or loaded. After recovery, the possibility to injure will increasing. The hamstring strain will occur due to the previous injury.
Now it's my turn to present the functional test of injured side. It's divided by 3. ROM test, strength test, and special test. ROM test.
To conduct the test, have your patient in supine lying position. Normally, you would start by assessing the unaffected leg first. Then, flex your patient's leg at the hip joint whilst keeping the knee in a fully extended position, and ask your patient to inform you once symptoms occur. Normally, you would expect radicular symptoms to occur in the range between 35 to 70 degrees of hip flexion. If pain is elicited past this range, this pain is mostly coming from the lumbar spine or the sacroiliac joint. To further assess the neurological tissue, perform a straight leg raise test until symptoms occur. Move out of the painful range and then either dorsiflex the ankle, which is referred to as the Bragas sign, or ask your patient to maximally flex the neck, which is referred to as the Neri sign. If pain is elicited during any of those two maneuvers, it indicates stretch of the dura mater or a lesion within the spinal cord, which could be caused by disc herniations or a tumor. As I've stated, the literature reports that the straight leg raise test is a very sensitive test that you can use to exclude a lumbar radiculopathy. If you want to confirm your diagnosis, be sure that you also include a thorough patient history, reflex and muscle testing in your assessment. Okay, this was our video.
Strength test.
Seated knee flexion. Secure the appropriate elastic TheraBand around a secure object. Sit in a chair and attach the elastic TheraBand around the ankle of the involved leg. Pull the heel under the chair through the available pain-free range and slowly return to the starting position. Perform 3 sets of 10 repetitions. Rest 1 minute between each set. To progress this activity, increase this exercise with the elastic TheraBand resistance or use an ankle weight.
Testing of the hamstrings. To isolate the hamstrings for hip extension, you will have the patient raise their leg straight up off the table, keeping the knee extended, and back off slightly, and hold this position for 5 seconds. go back to start and have them come up a concentric contraction against resistance and go back down eccentrically against resistance. For our hamstrings, for knee flexion, you will have them flex their knee, keeping it in neutral. And for the hamstrings as a whole, you will hold this position for 5 seconds. To isolate the semitendinosus, semimembranosus, you would turn the foot inward and hold for 5 seconds. And to isolate the biceps femoris, turn the foot outward and hold this for 5 seconds. And to do your concentric eccentric contraction, you would go back to start, have them come up against resistance and come back down against resistance. And that's hamstrings.
Special test.
In this video, I'm going to demonstrate the slump test, a common neurodynamic test for the lower limb. Hi and welcome back to PhysioTutors. In a review from the year 2010, the slump test was evaluated with ranges of sensitivity from 44 to 87% and ranges of specificity from 23 to 63%. During the slump test, you are maximally stretching the neural structures of the vertebral canal and foramen. The goal is to elicit pathological neurological symptoms such as shooting pain, numbness, or burning down into the lower limb. A positive slump test can serve as an indication for a herniated disc or nerve root entrapment. To conduct the test, ask your patient to sit on the long end of the table with the hips in neutral, meaning no rotation, abduction or adduction. Then the slump test follows this sequence. The patient is then asked to fold the hands behind the back and slump into lumbar and thoracic flexion while maintaining the head erect. Then gently apply overpressure over the shoulders with one arm and ask the patient to bring the chin to the chest. Add overpressure to this triple flexion position with the hand and ask the patient to actively extend the knee on the affected side. While maintaining this position, add passive dorsiflexion. That was the full sequence of the slump test. Your patient might display increase of symptoms at any given stage of this sequence. If that is the case, you're not going to continue with further sequential movements. The slump test is positive if neurological symptoms are reproduced. Some discomfort like tension over the hamstrings with restriction in knee extension or tension over thoracic spine levels T8, T9 are non-pathological symptoms not indicative of a positive test. Even if you think the slump test was positive, as with any neurodynamic test, you should not disregard sensory, motor and reflex assessment.
This is going to be the ELISE test to assess for contractures in the rectus femoris. To perform this test, have your patient in prone lying position. Then flex your patient's knee maximally. Make sure to compare both sides. This test would be positive for a tight rectus femoris if your patient's hip spontaneously flexes with knee flexion. Alright, this was our video on the ELISE test.
Exercise need to be done for strength. The first one is lying strengthening exercise. The second one is Norwegian leg curl. And the third one is standing bend pull down. This is the lesson plan for hamstring exercise rehabilitation. The objective of the lesson plan is to improve the muscle strength. For the warm-up, we have to do walking for 10 minutes. For the main activity, lying strengthening exercise, Norwegian leg curl, standing bend pull down. We have to do it for 5 reps and 3 sets. Rest between sets is 1 minute. For the cooling down, we have to do static stretching first. For additional information, do not force yourself to do this exercise more than what you can do, or it may get your injured worse.
Next, exercise need to be done for cardiovascular is stationary bike, grapevine jogging, and swimming. This is the lesson plan for cardiovascular endurance. The objective is to maintain cardiovascular endurance. Introduction is briefing about the activity for 5 minutes. Warm up, we will do static stretching for 10 minutes. Our main activity is stationary bike and we will do for 20 minutes. We will do ice therapy for cooling down for 10 minutes.
Exercise need to be done for flexibility have 3, which is using the wall, standing knee flexion, and effective chair stretch. This is lesson plan for flexibility. The objective of this lesson plan is to improve flexibility. For the warm-up is static stretching around 10 minutes. For the main activity, which is effective chair stretches, using the wall, standing knee flexion. All the exercise hold for 30 seconds to get full range of motion and repeat 3 times of this exercise. For the cooling down is not have here because the whole day in this activity is focused on flexibility. For the conclusion and recommendation, hamstring is a big major muscle in most sports. It is common used for track and field, soccer, basketball and combat sport. Athletes must concern about the hamstring physical conditioning to avoid from serious injury. And most importantly, warm-up is important to prevent our body from injury and also can increase our flexibility.
This is the reference for our presentation.